Hi and welcome back. Today we're going to discuss the most common screening tests. First, what is a screening test? This is a test that we run on people who are asymptomatic and not at increased risk of certain disease processes. The goal is to catch diseases in an early and treatable state.
You're my sick? Yeah, but that's not what we're here. We're here to do a test. Come on, what kind of test?
In my practice, I try to adhere to the guidelines set forth by the USPSTF, which is the United States Preventive Services Task Force. Now, each specialty has their own set of guidelines, like urologist or gynecologist, etc. But these are the ones that we use in primary care, and they are evidence-based guidelines. I adhere to them for the most part, but there are certain circumstances where we take each person into account. If you are having symptoms or if you have increased risk factors for these certain diseases, these rules do not apply to you. This is for what we would consider the general public.
You talking to me?
One of the easiest things, and something that we do every time nearly that you walk in a doctor's office, is check your blood pressure, starting at age 18 and up, but in some people we will do that even younger.
You sure about that? You sure about that? You sure about that?
Pap smears test for abnormal cells of the cervix, which are almost always caused by HPV, human papillomavirus. This is the test that we like to start at age 21, and in individuals where they've been normal, the recommendation currently is that you have those every 3 years. At age 30, that guideline changes and it turns into, from age 30 to 65, every 5 years if you have a co-test for HPV along with the PAP.
5 years later.
Next is colonoscopy. Recently, they decreased the starting age from 50 to 45. And if they're normal, those are repeated every 10 years. We usually recommend discontinuation of colon cancer screening at age 75. Mammograms. This is one where I don't exactly adhere to the USPSTF guideline, which is starting at age 50 and repeating every 2 years. That is a statistical recommendation, but in my practice, I generally start at age 40 and get them done every year. That's what I personally do. I have had many patients and friends who have gotten breast cancer in their 40s, and so I throw caution to the wind and get mammograms yearly in my patients. Bone density scans are recommended in individuals, not just women, age 65 and older. If you have risk factors for osteopenia or osteoporosis, we recommend those younger. I personally bend the rules here too a little bit, because I feel like if we wait until every woman is 65 years old, everybody is going to have osteoporosis. So I generally start screening my female patients when they hit menopause, because that's when we start to see bone density decline. Abdominal aortic aneurysm screening is recommended for men age 65 to 75 one time if you have ever been a smoker. If it shows up abnormal, then it's not a screening test anymore. For people age 50 to 80, we like to do lung cancer screening annually in the form of a low-dose CAT scan or CT. This is for people who have a 20-pack year history of smoking, meaning you've smoked 1 pack a day for 20 years or 2 packs a day for 10 years or greater. If you have quit smoking, congratulations. And once you have quit smoking for 15 years, it's okay to discontinue the screening. That's a snapshot into the more common screening tests that we recommend. Certainly, talk to your doctor or healthcare provider about what tests might be most appropriate for you. Don't forget to like and subscribe and tune in for more.